Hi, everyone. This is Sean with the Western Mass team of the MassSupport Network, here with your COVID-19 update for Tuesday, October 27th, 2020. Well, it's been something of a week. Cases worldwide in the country have hit record highs. Worldwide, we passed 43 million cases in total. And this is a record for new cases, seeing in the last week 3.2 million new cases. That's 800,000 additional cases over last week. And many of those cases came from the US, where we saw our worst week ever for new cases, which was 520,000 new cases in the last week. That's over 500,000 cases a week. We've never had a higher point than this. In the last couple of weeks, we've seen many articles which say the new case numbers for today are the highest they've been since August, since July. Well, we're not saying that anymore because they're just the highest they've ever been. Here in Massachusetts, we saw 7,300 new cases in the last week, which is not the highest they've ever been here, but we are still steadily ramping up there. That's over 2.8 thousand additional cases over last week. And in terms of deaths, things continue to rise there as well, with worldwide 43,000 deaths in the last week, which is about 6,000 more than the week before. Another 5,000 deaths here in the US. And Massachusetts, we saw about 128 deaths in the last week, which is 17 more than last week, which may be ramping up, might not. It's hard to say when the numbers are that small. But across the board, everything is trending up, as we'll see on the next slide here. So here you can see the trends in the country. Everything is on upswing. Testing is fortunately going up, but cases and hospitalizations are also trending upwards, as unfortunately our deaths as well. So we're going to look a lot at cases right now because those are the big story right now, but we should not ignore the others. So this is a closer up look at where we are in terms of new cases. So Friday and Saturday were in turn the highest single day ever for new cases. Depending on who you look at your numbers at, Friday or Saturday was the highest, but this was far and away the most cases we've seen in a single day twice. And as a result, the 7-day average has also increased to its highest point, blowing right past the highs set in July there. And we've had a pretty steep increase in the last couple of days, as you can see along the side of the chart here, as compared to where it was in the last peak in July. So breaking this down by region in the US to see where this is all happening, because while we are seeing our highest case numbers as a country, most regions in the US are not seeing their highest numbers. The Northeast and the South, which were previous epicenters, are seeing lower numbers than they did at one point, but everywhere is trending upwards. But the Midwest is really driving this latest spread, which is telling because the Midwest is perhaps the smallest region, well, second smallest after the Northeast, but one of the smallest regions and having some of the most cases there. And it has gone way past the raw numbers of what the Northeast saw back in the spring. However, this doesn't tell the full story because raw cases mean different things in different areas. So when we actually look at these by population, we get a much different picture. And this is adjusted for the regional daily cases per million people in that region. And there we go. The Midwest has now, by this metric, surpassed both of the previous spikes in the Northeast and the South. And it is now the hardest hit area for the pandemic. So that's just something to reflect on there. But also part of why we're seeing this is the highest spike is we've seen our two previous spikes, the spring spike in the Northeast and the summer spike in the South. And those were each kind of single spikes. Well, I mean, South and West hit the summer spike, but everyone spiking a bit now is trending to this highest case count with the Midwest leading the pack. And of course, some areas, we are having increased testing. We are catching more cases than we would otherwise, but that does not account enough for all the cases we're seeing now. And one way you can tell that is by looking at the hospitalizations and seeing how this is on the rise. So we got down to a low point there in September in hospitalizations, and now we're on our way back up. And we should expect to see this continue to climb. Hospitalizations trail a week or two after cases. And so in early November, we're going to see a lot more people in the hospital. So with that cheery note, let's move on to the developments for the week. Obviously, the big news there is that there is COVID in the vice president's office. At least 5 people in the vice president's office have tested positive for COVID, including his chief of staff. Vice President Pence tested negative on Sunday and say that he will not be quarantined and will continue with his duties and being on the campaign trail. So we'll see how that spreads from there. As we saw with the initial White House outbreak a few weeks ago, this can spread out pretty rapidly through a number of avenues in a city as interconnected as Washington, D.C. Next up, a new study came out on mask mandates out of the University of Kansas, where back in the summer, the governor of Kansas issued a mask mandate. However, due to the laws in the state governing the governor's emergency powers, counties were able to opt out of this mandate. And so in the end, only about 20% of the 105, 106 counties in Kansas ended up implementing mask mandates. So that meant that the University of Kansas was able to then go and look at county by county how cases trended, and we could correlate that with the mask mandate. So in the counties with a mask mandate that enforced it, they saw a decrease in new cases 14 days after the mandate started. And they stayed steady after that, occasional spikes, but more or less stayed online. The counties that did not enforce the mandate kept going up in terms of new cases. So then by the end of the study, the rates in no mask mandate counties were double that of what they were in the counties that enforced the mandate. There's a top development there was, of course, about the records being broken. My animation order seems to be a little messed up in this slide, but we've discussed that thoroughly about how our cases are at our highest point level. And one last note from the developments is that Eli Lilly, manufacturer of monoclonal antibody treatments, similar to the ones that the president received during his COVID case, reported that their antibody treatment does not appear to be effective in hospitalized cases. This is severe cases of COVID. So this is, of course, disappointing because this is something that we were looking forward to as being a possible treatment for multiple stages of the disease. But apparently once it gets to the severe cases, the antibodies aren't going to be very effective. Now, part of this may be because late stage COVID cases, it's really the immune system doing more damage than the disease itself in many of them, and that's where dexamethasone comes in instead. But now it looks like the Eli Lilly monoclonal antibodies will be most effective in places that are continuing to run trials for mild cases and for post-exposure prophylaxis, but late stage isn't going to show any benefits. In terms of the vaccines, There are limited, no real changes here, a few more added to phase 1. And also AstraZeneca restarted its trial in the US after briefly pausing when there was one death in their trial, which turned out to be from the placebo group. You can find the sources from the stats and trends at COVID tracking, New York Times, and mass.gov. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.